think plastic surgery, draws my attention in the first place because I think it's a really creative specialty. There's really no one single solution to a particular problem, and I think that is very important for me in many aspects, because I think every day, turning up to work feels like a bit of a new challenge. And even though, most of the surgery are fairly much principle based, like you'll follow sort of certain principles in terms of what you do, but each patient you have to really think a bit outside of the box in order to achieve the result that is particular for that patient. So I think having such a creative specialty really gives me the opportunity to, I think, keep thinking and keep thinking outside the box sometimes. And it's not uncommon that we got given a particular defect, say in the more reconstructive aspect of our surgery, that you have to think, okay, do I use plan A or B or C this time? And you do often need to have multiple plans, because sometimes plan A may not be the right sort of option in the first place. So it is very rare to have a surgical specialty, I think, that really gives you that much opportunity to think outside the box. So I think to me that really is what draws me to plastic surgery in the first instance. I think it's also quite a unique specialty in the sense that we often get to work with a lot of other specialists, and that's because there's so many cross-disciplinary interaction. I think often people sort of make a bit of a joke to say, we're plastic surgeons are often there to wrap up the case because we're often the last person to come and fill the defect. But I think that's the fun part of it. But I think the main thing is that we do work with frequently with our ENT colleagues or with our breast colleagues in terms of all these sort of major cancer reconstruction. Sometimes we work with our neurosurgeon colleague, our urologist colleague, and even our bariatric colleague these days, who often share a lot of the care with our patients as well. And so I think the fact that you're constantly catching up with your colleagues just over the patient care, I think that's also really keep us constantly in the forefront in a lot of area in medicine. So I think that also is something very unique to plastic surgery in particular. So I think these things really give me huge job satisfaction, and I think really encourage me to strive to do better and better each day with my work, because you have to constantly think and learn in the process.